Done.
He gets a gold star.
Hey,
Yep,
y'all.
we're on.
Okay, I'm gonna unmute them all from the back so all these mics will be on.
Yep, they're already done.
Oh, yeah.
Good teamwork.
Yes, Anthony is my favorite. Testing.
Can you hear me?
I think I'm getting my daughter to her dress rehearsal at 2 p.m. 5 minutes from now.
Can you hear me? Oh, okay.
Oh, you already? Hello?
With that, text a neighbor to come scooper.
Yeah.
Can you hear me?
It just texted him saying like.
Thanks for performing.
Testing, testing. You're hearing me. Testing, testing. Testing, testing. Testing.
Just
That's
turn it off. Just turn that one, like the.
Oh, yeah, I'll try to do.
There you go. This one is
We good? Nice.
She might get all their shoes.
Good. Okay.
You can get off the Yeah, if it wasn't for her.
It's meant to
Yep.
work with your faces. I'm not quite sure. It's not as though we have a ton of
Yeah.
families.
Here, the mic's on this old.
I saw Nicole come down. Nicole got a little heavier last day. There she is in back with that next back.
Nicole's a fan. Yeah. And her
Yeah.
husband,
I don't think I ever knew.
forget. And met. I bet you.
We've known each other since the boys were.
It's a small community in many lovely ways. See.
There was a lot of her
Mom.
There are a lot of her. And I didn't work outside though. So with you.
I'm so very grateful for Zoom and kinds of things that make it more possible than it was when I started this. But it's fun. I mean, their health, like I'll get off the phone in tears. I'm so upset about something that's happened to someone and they'll say things like, are they using supported decision making? Have you got them away from like, it's like, this is fine. Normal's what you know, right? Like, it's very sweet.
Yeah. Mom, have you eaten today?
I need good parents and advocates and training. My middle one, who's my trickiest child, helped me change the rules. That Monday came out right at the start of COVID, where if you like, you get money for like wearing and whatever, and disabilities, you don't listen down with equipment stuff. So it's been like, how will going stuff that is for it, like things that are OT recommendation, whatever, and finding it on the special website that you had to use, you're having it all get denied. They don't know what this is. No one can figure it out. And they did a lot of great testimony and working with me. And they used his story to train staff and change the rules and got every single thing we'd asked for. And so he is also
Through the school?
that has to do date. It was through the Department of because the person I was working with at the time was a guy who like vice chair of VDOE. And by their definition, no sped experience. And this had fallen to him and they'd outsourced a lot of it to a contractor with no sped experience because it was going to take 80 to use for tutoring as a gap for that time period. So portion of them were kids with disabilities, and only a portion of them were requesting specialized equipment or manipulations or whatever it is that they needed. And everyone else, you could only use it on tutoring. And so they just had.
You were lucky to figure that out.
Like they were all glazed over in front of the laptop trying to survive in the months. Like it was 20. And someone in our school sent it around and they're like, the money will probably go. That was a ton.
Well, that's what they ought to do, like block grants, that,
Right.
rather than this, you know, whatever they
Are you
do.
talking here?
And it was more like self-directed services where you would use it to choose a tutor, and so long as their rate was remotely reasonable, we choose them and they reimburse them, then it worked. Not seamless, but it did work.
Yeah,
It will.
you got equipment, then it worked.
It's what they ended up needing. My daughter got a math tutor, which is where she has a really hard time. My little one got a reading tutor. I really did a combination of right. I'm a Spanish immersion.
Oh, Lord.
And I don't speak Spanish.
Well, I took it in high school. That's the extent of it.
I've never taken anything.
Is that working out?
It's wonderful, and I'm thrilled, and Amelia translates emails for me and comes to work events and translates stuff from, I mean, she's fantastic. I mean, not like if a family's in crisis or whatever, but if I need to type a quick response and I was like, I'd rather use her than Google Translate. If I'm saying like, sure, I'll pass this off to our Spanish outreach person, or like, make sure you use this phrase or whatever it is. She's excellent.
Have her help me share.
Well, I know, she's, and she, I told her to use Maho, we have just 7 hours a week doing Spanish language outreach to ISA, and then she said, she probably needs someone who does not, which is fair. Think of someone at our national.
Is that sad?
No, which isn't to say there isn't someone,
Right, right,
it's just
but I
not,
mean,
certainly
we're-
not front of mind.
Or not, yeah.
And I should know. That's an area where I feel like we really need to grow. I mean, not just the Spanish, because that part's going fairly well with mine here,
Well,
but
I've tried like Muslim community. You know, different reaching out. Yeah, we need some of that.
someone in and of the community to be a bridge or something. Tricky. I've got to work on that, and then if a last month, someone asked for it in Valley, someone asked for translation. Not like I've never heard of these, but like you're not even on my list of language priorities and things to translate in, right? Since I have Korean and Chinese and Vietnamese, Spanish and English, and we usually do Arabic and foreign. These before, and maybe I never will, but I hate that I'm not helpful to you. I did that there. It seems like with AI advancing so quickly, we should be able to leverage for language translation.
Yeah, I remember in elementary school, the kids, one time they had labeled different things in the school with all the different, and there was like a water fountain. But there was a water fountain, and they had labeled that in all the languages that kids at that school spoke. And it was all, I was like, oh my God, there's that many different ones. And I thought it was so neat, you know, that.
My delegate always likes to say, I forget the number, they're 85 or 87 languages or something like that. So we've been in high school 3 blocks from us.
Right.
Like it's, you just can't find enough translators.
Is the neighbor coming or is dad there? Hey, air conditioning.
The one night I left, I could see there in the car.
Oh,
The one night I left him with my son, I took Ophelia to my mom's, happened around the anniversary of her death, so that he and I could hang out, she was closest to my mom. And the next morning, I texted Ray to say, how was drum practice? And he goes, oh, I just forgot to take it. And I was like, good, one event, one night with less children, and I took the dog, and still, you couldn't get him to the.
shit. Yeah. When you leave though, and you go on a trip, do you have to prep everything for the kid? Okay, all right. Well, then you're still in my generation. 'Cause, you know, these women clearly younger than you can walk out of that house and I'm like, how do you do that? I've never, no, I had to prep meals, write notes, prep clothes, prep everything.
I mean, in part, this is his own, the nature of his own disabilities and executive functioning issues that
Yeah.
he can do a project like fixing the air conditioning, which has taken him all week, but he'll watch videos for hours and do the deep dive and figure it out. But something that has to be done consistently on a schedule the same way, it's like he's just never gonna do it. So we try and play to each other, right? But means I essentially never leave the house without.
Right.
And it was better for the kids. I had surgery last year and I'm a terrible caregiver.
Mine was too.
Like trying to take care of me and it was so awkwardly and I'm like, Susan, could you really help me? You painted the walls in the living room. Like, that's what you're good at. I've been wanting to do it and make it look nicer because I can't like move about. And he did that. And then my daughter and sons like brought PT, took care of the dogs and stuff. And I was like, it's fine. We all got it done. It's like, just leave. Go do something else.
Yeah. Well, and my husband was in the Navy, you know, they'd be gone to deployment for, you know, months and months. And sometimes I think they'd be coming back and it'd be longer, extended. And I always swore that's what would keep us weird. As soon as you get out of the Navy, we're in trouble.
We grew up next to a naval base and it was, I mean, I remember going to my parents or my friends' homes and having their parents actually husbands go back and then wives. Doing but bills and mowing and I'm like, I can't do all this. I did all this while you.
Yeah.
And how frequent those arguments were, which I couldn't get even because they were happening around me all the time. But oh my golly.
Yep.
It's a lot of.
Yeah, and them coming back in and thinking they can just step back in it, and you're like, whoa, wait a minute, back off. Yeah.
Like,
Do you recognize? Well, do you recognize? One out there.
Elena.
Yeah, I saw.
Yeah. And then she talked to one of our lobbyists.
Okay.
And my friends here, the audience,
Oh, good.
parents and kids have
Good.
very. Yeah. A few, we got a few.
And there's somebody. There's a little shop that's here.
yes, I mean, their director of advocacy, different kind of civics. And these are
Oh,
change the business.
Something to talk about you about, and now I can't even think what it was.
Hey, sorry, I'm
Hi.
gonna say some stuff. Thank you guys. Appreciate it.
Thank you for doing this. We really
Yes.
appreciate it.
Give me one thing. Let's say 2 words, maybe more than 2 words.
We're good at it.
And I'm gonna semi-introduce y'all, but y'all should talk about the work you're doing, how you help people.
Your staff's done a
I
great
might,
job.
yeah, if like someone asks a question, feel free to like kind of get my attention. I'll give you guys the mic to answer, or talk about how you guys are helping people in their situation. Thank you.
Thank
Appreciate
you.
Good afternoon, everyone. Thank you so much for being here today. We're starting a little late because some folks are trickling in, but I really appreciate you joining us today. This is for you. I wanted to do this because there's a lot of things going on in DC right now that people are concerned about. I can go through the list: federal cuts and people losing their jobs, and our democracy, immigration, education, all sorts of things, right? But I felt like all the calls and emails I've been getting about Medicaid were the most frustrating and heartbreaking. And so I wanted to have, a summit or a town hall, whatever you want to call this, on just Medicaid, because I think this is going to really hurt our community and communities across Virginia and across the country. And I think this is particularly egregious because what we're saying, or what folks in Washington are saying, is that it's okay to cut Medicaid and then on the name of paying down our federal debt and deficit, but then on the other hand, pass a giant tax break for the wealthiest corporations who aren't even asking for it in many cases, based on the meetings I've had. But that's one of my political statements of the day. We'll try to keep this on hard, I think, but I'll also say it's been really nice to hear from many people in our community about their stories, about their experiences. And so this is also a forum for people to share their concerns, their questions, their stories. I'm going to get into it in a second. What you can do to help fight back Medicaid cuts, but I also want to say that even just speaking out is a huge step forward for us. And so please use your voice. You're not powerless in this fight against Medicaid cuts. I want to get a little wonky for a second. We have a panel of really amazing people doing great work in our community, but I'm going to walk through basically the question I get asked all the time, which is what is happening right now in this process and what is going on. What do the cuts on Medicaid mean? And so just generally, you may have heard this number, 880 billion. And so that is basically the committee that oversees Medicaid. They've been told to cut that much money in the budget. And the reason we know they're going to cut Medicaid is, one, because they've made public and private statements that Medicaid is one of their targets, and two, because the math only works out if you're cutting Medicaid to get that much money in cuts. And so when someone in DC says that we've never said the word Medicaid when we're talking about cuts, they're lying. They are absolutely targeting Medicaid as a place to cut. And so what does that cut mean for us in our community? Well, Virginia is one of a few states that passed Medicaid expansion recently. And part of Medicaid expansion in Virginia says that if the federal government cuts even 1% of its contributions to Virginia's Medicaid program, then everyone who benefited from Medicaid expansion over the past 8 years loses access to Medicaid. That's about 600,000 people across the Commonwealth of Virginia will completely lose Medicaid coverage. And that's just one proposal, right? And so there's another proposal out there that basically says, if you're someone on Medicaid and Medicaid spends a certain amount for you, we're going to cap that amount. Anything over that, you're in charge of paying for it yourself. And so you talk about your worst days, right? You talk about someone who has a really tough disability or is in the emergency room and needs life-saving care. Basically, the other proposal is saying that at a certain amount, you got to pay out of pocket. And if you can't pay it, then too bad, right? And so those are the two sort of proposals on the table that I've heard. There's a third one surrounding work requirements, basically saying that anyone on Medicaid is not working as a freeloader right now, and so they need to get to work, right? But I don't think they're going to cut much money or gain much from the work requirements because half the people on Medicaid already work, and the other half simply can't work in most cases, or have trouble finding employment because of maybe some implicit discrimination towards people in their situation. And so they're not going to get a lot more people working than are already working, and it's not going to cut much money that they're looking to cut, certainly not anywhere close to $800 billion. So that's kind of the wonky part of what's going on when it comes to Medicaid cuts. I'll say that we have 1.8 million Virginians enrolled in Medicaid. I think all of them will be affected. There are a lot of other Virginians who are not on Medicaid. And so in our community, I think about 11% of people are on Medicaid, more than you think. But the other 89% of people will suffer as well, because what will happen is because people don't have access to Medicaid anymore, they will be using emergency services at the hospitals more, and everyone's premiums will go up. And healthcare is already very difficult for people when it comes to paying their premiums and getting access to care. We're going to start to see hospitals close down. We're going to start to see people not have as much access to care generally, and we're going to start to see premiums go up as a result. So this will hurt not just the 11% on Medicaid, who are friends and neighbors or seniors or kids. It will also affect everyone else. And so I know there's a lack of empathy in our politics today, so I'll try to explain that to people who are not on Medicaid, that people on Medicaid matter, but also that it will affect you too. And so the other thing I want to talk about is that people who benefit from Medicaid. We're talking, Medicaid serves as an eligibility qualifier for free or reduced student meal eligibility in our state. And so that's something that people overlook. And a lot of people on Medicaid are kids, especially kids with disabilities and kids who have a chance to succeed if they just get access to the care that they need and can do amazing things for our society, for our community. Seniors, a lot of seniors simply can't pay their Medicare premiums, and Medicaid is able to help cover those. We had a gentleman reach out to us over the past couple of weeks because he couldn't pay off his Medicare premium, and we were able to work with Medicaid to get his Medicaid premium covered. Otherwise, he doesn't have access to care. That's almost a death sentence for him. And so I want to recognize someone else. Mayor Westfall, if you want to stand up. She's our Medicare, Medicaid. It's amazing. Our daughter, amazing, Congressman Jennifer Waxon, and has continued with us, and we're so happy to have her. And then anyone on my legislative staff as well, Elizabeth, Matt, anyone else, Fraser, anyone in our DC office, they've been a great resource for the product. We're definitely quite the big side. But just generally, the other question I get asked is, okay, I get the problem, what are you doing about it, right? And so, last week I speak out on the House floor pretty much every day, but usually there's one Medicaid speech a week because I think of these cuts to Medicaid as so egregious, and it's hard for me to let it go. And I think the more we speak out, the more pressure we put on the administration and on folks that are behind these cuts. I think the better the outcome for us. And so I've seen that in other arenas. We had people who lost their jobs or get their jobs back, veterans, and, federal workers who were doing really important work. And I'm hoping that the pressure can be ramped up on Medicaid as the budget is being debated right now. But we wrote a letter to Speaker Johnson opposing any cuts to Social Security, Medicare, and Medicaid. We wrote to the Energy and Commerce Committee, and we're doing a lot of other things. I can tell you all the things we're doing, but in the end, there's the courts, there's the Congress, but then there's the court of public opinion, and you matter a lot in this fight. And so the more people that speak up and tell their stories, I think the better we are going to be when it comes to fighting this. It certainly helps me fight it. It helps me put people who are opposing this in a tough spot. And I'm hoping that we get bipartisan support for opposing these cuts to Medicaid, and that we can actually get more people coverage long term. And so I think what's happening in DC is going in the wrong direction. And I hope we can get things back on track. But I have a feeling things might get harder before they get better. And just know that I'm here for you. And I'm not the only one too. So I want to finally end by introducing some really amazing people as well. They're going to introduce themselves a lot better than I will. But you've got Lucy here she's the director of advocacy at the ARC of Northern Virginia. Teresa Champion, who co-founded the Virginia Autism Project in 2009, and she'll talk about what they do. Kim Crowley, single mom and member of the Little Lobbyists, who've been amazing. And yeah, and then Dennis Finley, chair of the Virginia Board for People with Disabilities, and Sherry Takemata. Yes, I have a hard to pronounce name too. Sorry about that. She's a lead for Disability Justice and Strategic Initiative at the Independence Center in Northern Virginia. She'll talk about what they do, but we have a lot of resources in addition to our office. Please take advantage of them, and especially if things get even harder. Just know that we have a lot of people in our community who have your back, and we'll do everything we can for you. So thank you so much. And so we're going to hear from them, and we're going to hear from you for the rest of today. Thank you.
Good afternoon. Can you hear me all right?
Yeah.
Okay, thank you. As someone with a lot of hearing loss, I try and be sensitive to that. I'm Lucy with the ARC of Northern Virginia. I'm excited to be here and I'm really sad to be here. We do a lot for people with developmental disabilities across the lifespan, but because we know needs are the same for very many communities, we get thousands of calls each year from people with mental health disabilities, from people with aging related disabilities, adult injury related disabilities. And we are hearing constantly from people who rely on Medicaid and who are struggling. Part of our team are case managers for individuals who use state Medicaid services, not just for healthcare, which is how we think of it so often, but as I imagine a lot of folks in this room are familiar with, long-term care. That caregiver who literally lifts someone out of bed in the morning, the caregiver who makes sure someone is successful at their job, at finding it, at keeping it. Those folks who are managing our individuals with challenging behaviors and trying to keep them out of really dangerous crises, right? We are seeing people across the disability spectrum all day, every day, and our Special Needs Trust and Services Program work with people who also have mental health and aging related needs. So we're seeing folks who are experiencing the usage of Medicaid in nursing homes as they're navigating Alzheimer's and dementia, and folks who are moving in and out of institutional care and homelessness and mental health cycles. I just can't tell you how often the word Medicaid comes out of my mouth at my office because it is meant to be the program of last resort, and boy, is it. By the time people get to us, there is nothing else. They are exhausted. They have burned out their friends, their family, every dollar they had and their bank account, and Medicaid, it's all that's left as a safety net. And even then, I'm telling them, I can't be sure it'll be there for you immediately. A lot of the programs you may be eligible for actually have really long waiting lists. How long is that waiting list? Maybe a year, maybe a couple of years, maybe more than a couple of years for programs like the DD Medicaid waiver in Virginia. It's just the absolute backbone of our community, and it's always been a program that we've relied on so heavily. And the idea of having it cut, especially in ways that are so nebulous, really undefined and confusing to our community that needs a lot of help and understand to process information, is a massive driver of anxiety. I can't even imagine what the mental health side of Medicaid is looking at right now, right? As folks who are surviving with this program are trying to figure out how to use it in new ways, not knowing when the rug's going to be pulled out from under them. And as we say a lot, when Medicaid's your long-term caregiver, it's no joke if it stops covering your medical care and your seizure meds. It's also no joke if someone doesn't come to get you out of bed in the morning. And how long do we have before there's a bed sore? And how long do we have before no one's brought food into your house? And how long do we have that you can make it if we don't have those caregivers there? So I'm so grateful to Representative Subramanyam for always really having just a good ear and eye out for these kinds of issues, and for you all for being here and caring about this today.
Lucy and what she does at the ARC of Northern Virginia is amazing. I want to thank Congressman Subramanyam and his staff for putting this on today. This is so important. I'm Teresa Champion with the Virginia Autism Project, and we're a nonprofit. We were formed in 2009 to bring insurance coverage to families with a diagnosis of autism. Before that, autism was an exclusion in your insurance coverage. You could be having, your child could be receiving speech therapy or occupational therapy, and then you get a diagnosis of autism, and then all of that insurance coverage would stop. So now that's fixed, and it took us 10 years, but we stayed on working in Richmond on many different issues. We partner with the ARC of Northern Virginia, the Autism Society of Northern Virginia. Sharon and Connor are here today. We partner with the Virginia Board for People with Disabilities. We'll partner with anybody to work in Richmond. We work on issues about criminal justice reform, people who are in crisis with disabilities, encountering law enforcement, social services, Medicaid, housing, anything. 61 million people in the US live with disabilities. That's 1 in 4 adults. And you're not the only ones worried about this. Tell your stories. Please tell your stories. We want to hear your stories. How Medicaid supports you at home. Medicaid waivers. A lot of people, I find a lot of legislators don't understand what a Medicaid waiver is. I didn't until I lived a life that my son required using one. So I think we need to be very vocal about how we use it. The Virginia Autism Project, we've got a mailing list, we've got an action list. So we like to text or email you action alerts. We have a QR code over there. Just please join our list and join us and get the word out. Thank you so much for being here. We really appreciate it.
My name is Kim Crawley, and I am here with Little Lobbyists today. We are the only national family-led organization that advocates for kids with all types of disabilities. I actually became kind of an accidental advocate, as we say, in 2010 when my son, sitting in the front here, lost his health care when he hit a $2 million lifetime maximum at 15 months old. And I started just telling his story to anybody who would listen, because I realized when you put a face behind the speech, it actually is meaningful and a little bit harder to ignore. And I was very lucky to run across some families in 2017 who had the same idea that I had, but on a huge, much bigger level. And that was the inception of the Little Lobbyists. We are super lucky to have been working with them all these years. We tell our kids stories. We've walked the halls of Congress and the Senate and talked to representatives for families who can't come to DC and tell their stories. We tell our own stories. We're available typically at the drop of a hat. We try to be for anybody who needs us. But really putting a face behind the Medicaid and the stories and the numbers that are very meaningful, but they mean a little bit more when you have to look a kid in the eye and tell them this is what you're taking away from them, or an adult, and tell them this is what you're taking away from their family. And for us, Medicaid is a lifeline. It's, Isaac has primary health insurance, but Medicaid covers the things that primary health insurance does not, which is an incredible list that nobody realized exists. Physical therapy, occupational therapy, speech therapy, durable medical equipment. Isaac had a trach until he was 12, and Medicaid paid for all of his supplies for his trach and his nursing and home nursing. Insurance is great, but they only pay for 90 days a year of in-home healthcare nursing. And after that, as a single mom, I'm not sure I would have been able to go to work every day. Those additional, 275 days a year, we're just coasting on our own without Medicaid. So for us and for our community, Medicaid is really the safety net, and it's really the reason why our kids are at home and thriving and living in their communities and sharing their joy and participating in school and functions. And here today, they're here because they have access to Medicaid and they can live at home and be like the rest of us. And that's really what they deserve. And in telling their stories, it helps to put a face to the numbers. It helps to show that our kids are here they're a part of the community. We're not hiding them. They're not hiding. They are ready to go out and take to the streets and be great human beings. And, you know, I've got a kid who wants to be a chef someday, and, you know, they have dreams like everybody else, and keeping them at home benefits not just them, but their communities and their families.
Good afternoon, and Congressman, thank you again. I'm Dennis Finley, and I live in neighboring Fairfax County, and I wear two hats up here. I'm a dad. I'm an architect by profession. I have twin boys, one of whom has significant intellectual disabilities. Everything about his life is supported by Medicaid. His group home, where he lives, his activities of daily living, meals, medication, day program, and being out in the community which he loves. He has what's called, as Teresa alluded to, a Medicaid funded waiver, which means he can receive services not in an institution, something that the state of Virginia has spent now a decade and a half trying to eliminate. If he were to lose his Medicaid funding, I fear that he would wind up in an institution. He could wind up in a hospital, and given that he does have significant behavioral issues, he could end up in jail. And it's terrifying. Because he gets survivor social security benefits, on my late wife's work record, he's what's called dual eligible. He gets both Medicaid and Medicare. The other hat I wear is this chair of the Virginia Board of People with Disabilities. I was first appointed by then Governor King came to that seat in 2009, and I've been reappointed by 3 of his successors. Every state has a disability board or disability council. They're mandated by the federal government to exist and are mostly funded by the federal government. Our primary job is to educate members of the General Assembly, the governor, and the public on all matters related to disabled Virginians. We also award grants, a little bit over $1 million a year, for various disability initiatives, programs, playgrounds, information access, you name it. We are trying to get at it directly with money and dollars on the ground. We also do we just lost.
Yes.
IMD. Is this one working? We also do a lot of statistical research. The board you see on the easel and the handouts you have came from us. I will share with you that about 3.5 weeks ago, a document leaked out that wasn't supposed to leak out from the federal government. It was about a 60-page document that was going back and forth between the Office of Management and Budget and Health and Human Services. And directly under the heading of programs to be eliminated, funding for all the disability councils across the nation, including us, as well as legal and voting assistance for those with disabilities, among other things. It was a very long list of things that were line itemed out under the heading of programs to be eliminated. It was a working document. It said not for distribution, but it did get leaked out. I was going to share a few statistics, but I think you see them on the easel and you have them in your hands. I will share with you, to the extent I can, that given that the Disability Board mandate is to educate the General Assembly and the governor and the public of Virginia, we are working our channels to the best that we can through the state to the federal government to advocate for everything that everybody has talked about. We started getting inundated, as did the Congressman's office, in early February with calls from people who were fearful. And we have put out information about programs that are there by law, which cannot be changed, and programs that are there through federal agencies. So they were not, you've probably heard the conversation about, if it's not mandated by Congress, can that be eliminated? We've gone through both in the educational area for those with disabilities and the care area for programs that are mandated by law, one that cannot be changed. You might move them to another responsibility, another agency, but you can't eliminate them, and programs that are there because the agencies initiated them and that are possibly on the chopping block. So just know that the Virginia Board of People with Disabilities is working very hard, mostly behind the scenes, in advocating for all those on Medicaid in Virginia. Thank you.
Hi, is this right? Okay. Hi, my name is Sherry Takamoto, and I'm the lead for disability justice at a place called the Independent Center of Northern Virginia. We are one of, I think, about 177 centers for independent living in the country, also on the cutting block. And I'm not going to go spend a lot of time telling you what we do because we do so much. There's a handout over there, free pens. If you know anybody who has a disability who wants some help or advocacy, you have our number here. The other, adding to the list that Dennis just had, we have the Department of Education that oversees special education and protects the rights of our children with disabilities to get a fair chance in school. So keep an eye on that. And I just want to say, disability isn't a choice, it's a reality, right? We can ignore that and go backwards and treat people with disabilities as wards, sick, or needy. We can define them by what they can't do, and that's what people often do. Or we can consider them for what they can do. And Medicaid is essential, as folks have said, to what people are able to do in our world, in our homes, in our community. And it's an investment that can support their independence and positive contributions. So not everybody's going to be able to talk today. And I just want to know, how many of you have a disability or care deeply about a person with a disability, chronic health conditions, kidney, heart conditions? You know what? Everywhere I go, it's not just these Medicaid things, but everywhere I go, I ask that question because disability is something that touches all of us. It may not be the primary way that we identify ourselves, but it's something that touches us all. This, if it doesn't, for those of you who didn't raise your hand, count your blessings. Right? Count your blessings. And I hope that you can care about us who are caregivers and people with disabilities. And I'm going to tell you a couple of things about, I'm going to give you a few stories that you haven't heard yet today to get you thinking about your own story. First, my son, Pete, turned 37 a couple of weeks ago. He has a developmental disability and a genetic condition that affects his heart, skin, motor control, eyes, and brains. Also, he throws up fairly constantly, so probably affects his stomach too. He lives in his own apartment with his best friend from school. He has two jobs, Safeway, where he's worked for 20 years, and Vitality Living, where he cares for patients with Alzheimer's. Medicaid covers his health expenses and supports his living independently. Without that, he would be somewhere else with all the needs that he has. Like Pete and many of the other folks here, we asked Angie, a woman living in her own apartment, why Medicaid was important to her. And she said, pays for her breathing machine, diabetes medication, a brace for her leg condition, a live-in aid, a stomach specialist, medical transportation, and it also supports her being able to work. Those are folks with developmental disability. And Medicaid, the Medicaid waiver that folks talked about makes it possible for Pete and Angie to live amazing lives and contribute to their communities. We at ECMD support folks with all disabilities, including those who become disabled later in life. And disability, as you know, can strike any of us. If it does, Medicaid is a support and safety net that can make the difference between, that's my talking thing. Between dignity and independence and unnecessarily institutionalization and death. 3 more brief stories and they're sentences. Laura is an intern where I work at ECMV who became blind while at Georgetown studying to be a policy analyst. She uses Medicaid to work, to be able to come to work, and hopes to be off Medicaid and working as a policy analyst. Are you looking for someone to work in the office? Sarah's health conditions and medical expenses left her unable to work, and it exhausted her savings. Did you know that 67% of us are 1 paycheck away from being able to not pay our bills? And medical expenses are the leading cause for bankruptcy in the United States. So it's something that can affect anyone. She ended up in a nursing home, but with long-term care service was able to get out into her own community and in the community. And finally, Iojima was diagnosed with ovarian cancer a couple of years ago, in and out of the hospital for over a year. Her treatment for 1 month in the hospital was $30,000, and $26,000 is what her chemo treatment costs her. Without Medicaid, she's dead. So, is Medicaid worth saving? Of course. What some consider to be a waste costs more in the long run, not just for us with disabilities, but for those who care about folks with disabilities. So every day you take 1 step forward, protest, write letters, use your blue pen. You can feed a groundswell that is needed to regain the equilibrium from our earth that is shattering below us. Add your story to these stories today, and together we can do this. Thank you.
Thank you so much to our guests today. So please start lining up if you'd like to share your story or have any questions for us. And go ahead. And while you're doing that, I'll just say, just hearing some of these stories, it frustrates me that we're even having this conversation, that we're even here today. Because I think Medicaid should be covering more things. I think we should be helping expand Medicaid. But instead, we're in a position right now where, despite being the most richest, powerful country in the world, we're not willing to cover healthcare for our kids or our seniors or the people who need it most. And so that is a shame. It's shameful, and we should fight that rest of the way. So thank you all for all that you're doing to support our community. Thank you.
This young man is supposed to go to the money, so he's already through it. And then you'll be fine. Yes, we want.
Go ahead.
Thanks.
Could you say your name and where you're from?
My name is Connor Cummings, and I'm proud to be autistic. I'm in Fairfax, Virginia. I wear my Mickey Mouse ears because they help me feel confident and comfortable. I wrote these words because I believe 1 person can make a difference in this room. And with all these ones, just think how powerful we can be. Now, here are my words. My name is Connor Cummings. I am a self-advocate and proud to be autistic. Medicaid helps so many people in need, the elder, the poor, and people with disabilities. Medicaid can pay for health care as well as for long-term care. Medicaid pays for my friends that need support to get out of bed, to get dressed, and to live their best life each day. It also helps our friends to go to work, cook, and be as independent as possible. Medicaid is another word for safe. Medicaid saves money, and it gives us dignity. Medicaid gives us an alternative to stay out of hospitals and nursing homes. Most people I know want to live our lives at home with a family member, roommate, a couple of true friends, or a caregiver. You can do this and save money. I am hoping you hear my words. You hear all our words. President Trump, you have a power to assure that no one with these needs love or have her benefits cut. Even the cut is an emergency. I haven't met you yet. I haven't been to the White House yet to speak my written words. I don't think you're a bad person, though. However, I have heard your words so many times saying that you will not cut Medicaid, Medicare, or Social Security. You are a smart man. You are the president of the United States. You could do one of the most important things ever for all people, even if people don't receive Medicaid themselves. I guarantee they have a loved one who does. You task Elon Musk to reduce the budget. He seems he's doing that all right. All the millionaire and billionaire men I saw speaking together, they can save not only money, but lives and not cut Medicaid, Medicare, or Social Security, just like all of you pledged to do. I believe together we can all make such a difference. A United States and the world we all dream of. You, Mr. President Trump, can lead us by not making cuts. I, Connor Cummings, and my mom will help you any way we can. Together, we could be a part of a solution and end the fear that so many families are feeling at this point, to not only keep the benefits we have, but to enhance them and turn the fear into a magical joy. P.S. I want you to for your positive results, Mr. President. Please and thank you, Connor.
Thank you, Simon.
No problem.
I have to follow that. Thank you so much for that. That was so valuable. I absolutely adored it. I was so touched by that. I'm a speech language pathologist. My name is Tina Gonchler, and I'm so grateful for this entire panel being here. Thank you so much, Representative, for being here and hosting these town halls. I know these are dark times, and now more than ever, it's very important for all of our voices to be heard, and now it's tougher than ever with all the pushback and the fight back. So I'm kind of an introvert, so I feel very awkward with public speaking. I wouldn't even know it. So I work for a Title I school with Loudoun County Public Schools, and I would easily say that over 80% of my students are on Medicaid services. And so that goes for the entire student body at our school in Sterling Park. So the majority of them are on free and reduced lunch. I see that a lot of our students come in hungry. A lot of them are in McKinney-Vento also, so they're homeless. And it's just, I mean, I am so willing to do whatever I need to do on my behalf to document every single student's services at the end of the day to make sure it gets to our administration and the billing offices so they can bill for the Medicaid and make sure these students get their funding that they need and that the school systems get the funding that they need. I will do whatever it takes on my part to make sure their voices are heard as well. So I'm distraught by I've heard some fresh news today, and it's very disturbing because a lot of us are thinking what's going to happen. A lot of these students, they come in with special needs, they're on an IEP, they have an IEP, and this is a federal document, and they're under IDEA, so it's required by law that their Medicaid services are funding for their OT, PT, and SLP services. So, I just want to raise my concern as well, and I'm just so grateful for you guys being here today. Thank you.
Thank you. And probably two points. One is, well, thank you for all that you do, and really. One is there's going to be Medicaid cuts, but there's also be cuts to other programs that really help people who are Medicaid, right? And some of the ancillary programs. So the more we're trying to get a good list going of those programs so we can prevent those cuts as well. It's not just the fight about Medicaid. And so I appreciate you brought up a couple that are are Medicaid cuts, there's some that are not specifically a Medicaid cut, but are still a cut. The second thing is the word cut will not be used by the folks who want to cut Medicaid. Those call reform. Modernization is another word that I've used, and don't be fooled by that. It is a cut. And again, a 1% cut in Virginia means that 600,000 people will no longer have access to Medicaid. And so that is a very significant thing. We will probably be hurt more than any other state in the country by these Medicaid cuts. We have to not forget that when we're talking about how to fight this. So thank you for all that you do, and I appreciate you bringing that up. Go ahead.
Excellent. Hi, my name is Athena Jones. I came here about 4 hours away from Portsmouth, Virginia. I appreciate the applaud, but instead of us applauding, we need to organize. Instead of applauding, we need to move to where we tell our stories. See, the reality is we're living in a system where they want to continue to quiet the people who don't deserve to be quiet. They want to eliminate things because they want to create tax breaks for the wealthy. But the reality is we're not going to stand back and sit back. We know what it's like to have to fight for the ones that we love. We know what it's like to command space and presence. And we have to do that now more than ever. The reality is that these billionaires have millions of dollars, billions of dollars to be able to move systems and policies. But they can't do that if we allow them and we stop them. It is up to us. I was in DC on Wednesday, and when I was talking to the congressman, I said, what are we doing? What do we need to do? And she said, first of all, we need 4 Republicans, 4. And then she said, but the stories that we're telling are making a difference. Tell your story. Be unapologetic about it. Be fearless about it. Because the reality is we're living in a time where when you are quiet, you are complicit. If you have a family member with a disability and you refuse to speak up, I will say you are complicit. Oh, it's okay. Because the reality is we have to move a system because it's set up so that the billionaires can thrive in a way where we don't get a voice anymore. And if we don't use our voices, it will be taken away. And it will be unapologetically taken away. And so I want to make sure I represent home care workers for SEIU. I represent an opportunity for a community of people who not only work with individuals with disabilities, have silent disabilities as well themselves, don't get benefits, don't get sick days we just got, we don't get a 401k. We're going to sell a lot of things with the trigger thing that's going to happen. 663,000 Virginians are going to be impacted by that. And the reality is, again, we have to tell our stories. We have to demand and command the space. And if we don't do it, we are handing away the future of the people that we love. And if we do that, that's our own fault. Thank you.
Hi, I'm Patty Nelson, and I have learned long ago I should never follow my union sister Athena. But I just wanted to say I'm a retired nurse. I'm with SEIU, but I'm a retired nurse from Loudoun County Mental Health. And we in the SEIU and people from across the Commonwealth worked so hard to get this Medicaid expansion. We saw it on a daily basis. And people don't realize in Loudoun County, I mean, people who came in with the worst psychiatric illness and the least resources, we had 50% of them had Medicaid, Medicare, and 40% had no insurance at all. And I teamed up a group of nurses who were crawling under cupboards looking for medicine for people to keep them stable, to keep them in the community, to keep them with their families. People have no idea. It's immeasurable the extent of the cruelty of pulling Medicaid. So, thanks.
Thank you.
So my youngest daughter is a special needs educator. And I learned about Medicaid because she got to the point where she wanted to be able to step back from teaching to teaching online so she could have her first baby. And at the same time, my husband was in his last year of fighting brain cancer. So she and her South African husband just moved in with us to help give him motivation to live and to help with the care because we were caring for him at home. she wouldn't have been able to make it through that pregnancy without Medicaid. I was surprised by the good care she got. Even a doula, I didn't know they called them that in the United States. I knew them as midwives in Germany. But that made it possible for her to live with us and get the health care that she needed. And the baby could get the health care the baby needed. Now she's out here with number 2 and no longer living with us. But I'm grateful. And I look at this list here, it says 34% of births are through Medicaid help. That's helping a lot of women who could, if they could not afford health care, would not be able to afford to have a baby. Or if they're in the baby way and can't afford it, they can't afford the health care they need to keep that baby healthy and keep themselves healthy at the same time. It's not one or the other, it's both are covered. As long, and it's a lot longer than I thought. And yet at the same time, the government's starting to talk about, oh, we have a declining birth rate. We need to do this or that. No, the best thing for the birth rate is to Medicaid to help them stay healthy. And that's not dependent on their job. She was working, she was teaching online, but it was not enough to support their needs and health insurance. So again, if we want to have a society that cares for women and babies, it has to care for all of them, and that means Medicaid. Thank you.
The birth rate thing is interesting. That's a really good point, because I'm hearing a lot from folks about how we need to address the declining birth rate. And a great way would be to expand Medicaid or protect Medicaid, right? So I'm going to use that one. Thank you for that.
Hi, my name is Janice Saylor. I am a grandparent of 2 intellectually disabled and autism and ADHD and oppositional defiance disorder. You name it, they've got it, twins. I have been their legal guardian for the last 15 years. And as soon as the election was decided by people who don't know any better, I started changing my plans. I'm like, the last 15 years that I have planned for is down the tubes. And I do want to say that one of my grandsons is here. He voted for you. He asked me to come up here and talk. So both the boys, they're twins. They have Medicaid. They have an SRAP. They are now living on their own in their own apartments. They were on the Medicaid waiver wait list from the time they were 5 years old. One of them got it at 18 because his behaviors were so dangerous that we needed to make sure that he had the support, and we needed to have the support in our home. The one that is here now, he just got his waiver last year because he didn't need it until last year, until the time that he moved out into his own apartment. He's been working for the last 9 years since high school. He is independent. He rides his bike to work. He's managing kind of his money. He's got an aide that comes in twice a week. The other one is in a 2-bedroom apartment with a live-in and someone that comes in during the week to make sure that he's safe. I don't know what we're going to do. Fortunately, I have a house, and I fully expect if all of this stuff goes through, they're all going to be living with me again. They're going to lose everything. One of them, one of his to keep him from getting the esophagus, cancer of the esophagus, is $7,000 a month without Medicaid. The other one that controls his behaviors so that he doesn't end up in jail or worse I mean, I'm sure it's like $1,000 a month. I mean, it's just crazy. And I'm so thankful, for this. We need it. How many others are here with children that have disabilities? You're raising your children.
How many people here benefit from Medicaid? Either you or your family. It's a lot of people. When people ask me who's not Medicaid, they say like talk to your neighbors. Probably many of them. And you know, we have some numbers up there, right? But you know, it's our community, these are our neighbors, these are our friends.
Yeah.
Seniors, kids, and they deserve better.
And I apologize for my parents who just came from Special Olympics sports, so.
I could jump off of that comment. Thank you so much and thank your grandson for encouraging you to come up. Home and community-based services, that's a Medicaid waiver. And again, these are pieces of our lives that allow individuals to live in the community and not in a nursing home or an institution. We closed the institutions in Virginia. DOJ had to make us do that, but we did. So someone who, and frequently individuals with disabilities do have complex behaviors. They're not going to be able to live in a group home setting frequently with a lot of other people in a group home. So we need to be able to support them in their own homes in the community with a home and community-based waiver. Thank you. Thank you for your comments.
Hello, my name is Shaheen Vora. I'm a dentist. And I work with Medicaid offices. I see patients from 5 different. Yeah, I see patients with Medicaid from 5 different states, from DC, Maryland, Virginia, Pennsylvania, and West Virginia. I work in a bunch of practices. I've also worked for the free clinic over here. And thank you to all of you who worked to make Medicaid and access and increase the reimbursement for patients. Just to tell you, Medicaid is, with my patients, 90% of my patients are Medicaid. The rest, 5% don't have insurance. The rest are PPO. Even with the PPO patient, the maximum dental coverage is $1,500 to $2,000, which is one root canal, one crown, you're done for the year. But with Medicaid, I'm sorry, I'm not a speaker, so my thoughts are like all over the place. But a lot of my patients are from ARC, a lot of them from nursing homes, a lot of them are parents, children who've given up their jobs to take care of their disabled parents, and that's why they got approved for Medicaid. The parent needs them 24/7. They can't afford a nursing person to nurse them at home, so they stay back to take care of them. I see a lot of those. So I know this is going to affect all of us. My own assistants are on Medicaid. I have an assistant who has 3 kids. She works 2 jobs. Her husband works 2 jobs. She made $200 more 1 month. Her Medicaid was taken away. Both the parents didn't have Medicaid. And her kids, ADHD, autism, they all need the assistance. So this is very important, and I understand it. But what I'm going to say next, a lot of people are not going to like it. The foreign aid, the military aid that our government gives to other countries is way more than what we get as Medicaid. I'm a part of Doctors Against Genocide. I've been going to the Hill for the past 1 year, talking to everybody about this. And we get a lot of pushback saying, and we heard it from everybody, it's defense, we're helping other countries save their people. But at the same time, another country, you're increasing the refugee crisis. Most of the refugees that are in our country are because our country sent military there, bombed their homes, and now they don't have any place to go, so they come here. Similarly, what's happening right now in the Middle East, it's an ethnic cleansing, and the amount of military aid that's given to them, September 2024, $8.7 billion worth of military aid. April 2024, $14.3 billion. The proposed bill on sale for January 2025 was $8 billion. And recently, Mark Rubio declared that they're going to fast track $4 billion and they're going to override the congressional vote and send the money and send those bombs. This is why Medicaid is being cut. And we all need to speak up. Whether children within this country or children outside the country, they all are children. And it's important that we talk about it. We've called you before, we met with you before. And you need to understand that what we're saying is not just for those people, it's for the people within our country too. The Medicaid situation was never as bad as it is right now. And this is because the money needs to go to bomb some other country and starve those children. I have a friend, Dr. Razana Nahas, if you ever seen the CNN or the news, she's been there for 60 days now. There was no medical supply. The doctors went from here. They were not allowed to take important supplies. There's no anesthetic. Children are being amputated without anesthesia, C-sections without anesthesia. And yes, we don't want our money going to the countries outside, and we want to keep the money here, but it's important to stop what's going on outside the country so we can keep the money within our country and help the people over here. A lot of us are immigrants. A lot of us are refugees too from over here. And it's important that we help them at the same time. So if we want to keep the Medicaid, we need to stop the bombs going to other countries. Thank you for listening.
Yeah, just to add, one of the proposals at first was to cut defense spending by 8%, but in this budget, it looks like they're going to increase it by 13%, I believe. And so again, that's another place where Medicaid dollars that are being cut are going to go towards is defense, right? So it's a very good line of thinking.
Thank you, Congressman, and to all the panels and everyone who spoke. This is a really, really essential town hall, and I appreciate everyone's participation. I've heard a lot of talk on Medicaid, and I would like to shift the conversation a little bit towards long-term solutions. So as I've seen you grow, you were my state senator also, and you've done wonderful things, and I would love to see you continue with this and, leave a good legacy also. For myself, my name is Alia Khan, and I've been living in Loudoun County, like in CD10, for about 2 decades now. And I'm a community activist, I'm a human rights activist also, and I represent the community. I'm not a doctor, but I appreciate everything that Sister Shaheen just spoke about. And I don't think human lives are a game to be played with, for any of our political leaders. So I was involved in Bernice, obviously delegate 2016 and 2020. You can see I still carry my bags. And I also authored a resolution on Medicare for all at the state level. So, we do have other options at the state level too, if we have trouble at the federal level. But I think we need to really shift the focus, to long-term solution. Currently, I'm unemployed. I don't have health care. It's been 2 years. I lost my job. And I think as you age, there's many factors that it's just hard to find job. So I have no Medicaid, no health care at all at the moment. Okay. And I encourage you to partner with Congresswoman Jayapala Pramila. I believe she has introduced a Medicare for All Act. And if you could please continue these kind of conversations, but more towards the permanent solutions, maybe partner with her and engage us more. What can we do, like protests, like writing letters, and you to sponsor that act, please. Please, I really, really, would appreciate that. And then also work with your colleagues to also sponsor that act so that we can have a permanent solution. We are not doing these, short-term patches, because that's what these are. Okay, once we have Medicare for all, and it includes slowly, it expands to include everyone, it's a human right, right? Healthcare is a human right. And we are the, the most powerful country in the world. We should put America first. We should put our citizens first also, instead of, like, again, what Sister Shaheen said, spending money on, negative things that have, bad impacts on human lives. We need to save human lives, and we need to begin from home. And I really, really encourage you again to please partner with Congresswoman Jayapala and lead us towards that journey and become a legacy. Thank you.
Thank you. Like I said before, I think we're going in the wrong direction. We're cutting, or we should be increasing access. I'd like to see everyone in this country have access to healthcare, affordable, quality healthcare. And so that's one proposal, there's many others too. But we need a path to getting there. I could talk for a lot longer on that. But I really think we need, I see other countries have universal healthcare, for instance, and it's not so bad. Right? It's really not that bad, I promise you. You can have supplements if you want more than the care that's currently there. My first job, one of my first jobs out of college, I actually worked for a member of Congress on the Affordable Care Act. It's not called the Affordable Care Act. We had a public option, and that bill got taken away. I think one of the biggest mistakes we made policy-wise the past 15 years. And I hope that we'll have that conversation again soon. But right now, let's start by protecting what we have, and hopefully we can get to where everyone can have healthcare. So thank you.
I wanted, if it's all right, to jump in and think we absolutely must talk about preventative healthcare. Hugely important, cost-saving, ethical, human right. When we talk about Medicaid as a long-term care service, that in-home caregiver, the same exact principles apply. And United Cerebral Palsy puts out this fantastic national report every year called the Case for Inclusion. And they looked at the state best in the country for providing high quality care for people with developmental disabilities. They have no waiting list to get it, and their average cost per person per year was $40,000, compared to Virginia, who at the time ranked around 40th in the country for an average per person cost of more than $70,000 per year. It's just such an awful reminder that you always cost yourself more by trying to save that money up front when you keep people safe, happy, healthy out of a crisis. Both through medical care and in-home care, you are doing yourself a financial favor as much as you're doing yourself an ethical favor.
I'm really glad this is not an outdoor event, right?
Hello. For starters, I'd like to say, Congressman, that I voted for you in the primaries and early primaries, and I was really disappointed when the Washington Post projected that you weren't going to win, that someone else, or when they actually endorsed another candidate. And then I was glad that they were wrong because I voted for you. But what I'm here to discuss is that we're all worried about how Medicaid, how the Trump cuts are going to affect us. And the way it's affected me is okay. So the way it's affected me, I'm only the 10th American to have volunteered for a clinical trial for a disease that there is yet no cure, and phase 1 safety and efficacy. And I'm very proud that I, for as fearful as I was to undergo this treatment, which we don't even know whether it was safe, that I did it. And I don't know for sure, but I feel that this trial that was spearheaded and funded by President Biden is probably going to be cut or has been cut. And there will be a lot of people who may not have access to a cure in the future. So that's how it's affected me so far. But I don't have a polished speech for you. I have some stream of consciousness thoughts, and I hope you will polish it up for me. Okay, random thoughts. So I'm watching TV and I'm thinking, well, it's affected me that way, but I was still lucky. And I'm lucky that I'm not on Medicaid. But then I'm thinking, there are a lot of people probably think, well, this is not going to affect me because I'm not in Medicaid. And I'm wondering if maybe that's not true. Like, for an example, these are just random thoughts, but there are a lot of middle-class people that are in nursing homes and their coverage is financed by Medicaid. Now, even if I'm scrimping and saving so that I don't go on Medicaid if I ever need to go in a nursing home, but I'm thinking, however, if a nursing home has finite funds and now Medicaid funding is cut, and what are they going to do? Are they going to throw out the people who are on Medicaid, or are they simply going to do more with less? So that could that mean that a middle-class American who's on Medicare, a middle-class American who has scrimped and saved to pay for long-term care, or has scrimped and saved to have their own assets to pay for a nursing home, that all of a sudden they're going to be in a nursing home where the quality of care can be really diminished because there's a smaller pool. So I guess the thought I'm trying to say is that many of us Americans, we feel comfortable. Well, I'm not in the cohort that has been affected by these cuts, but maybe we're kind of delusional, so to speak. And I'm wondering if the Democrats need to wake up the general population and tell them, yeah, you're not under Medicaid, but wait and see how this will affect you indirectly. And I really hope that Congressmen think about this and communicate this to the public. And then one last random thought. I'm looking at that chart, and I think Democrats have a messaging problem. And I'm old enough to remember Ross Perot when he was campaigning against Clinton, and he had those charts. Okay, so I'm thinking, if I were to ask you or anybody, could you tell me what the pay ratio is between CEOs and workers today, as opposed to the year that President Trump was born, or 20 years ago? I don't think anybody knows the answer. So if we had someone like Ross Perot and would have this chart like per administration, what's the ratio? Show figures like that. One CEO to how many workers, their salary, what is the ratio in terms of salary? I think that would wake people up, because I think a lot of the younger people only know the world we're in, but it wasn't like this 50 years ago. Like my uncles and all, they were single family earners, they were painters in the union, they had 5 children, a house, a car, all that on one. So that's another problem that I think Congress is not communicating. What is this reality really like? It wasn't always like this. And I think that what we need is more charts and more a la Ross Perot. So
We'll give you some charts.
okay, thank you.
A couple of things. First, one housekeeping item. I was told that the folks can keep it a little bit shorter. I'm going to be terrible at waiting you, but you do your best to be a little brief. We don't have the room for that long. But you made 2 good points. One is that a lot of people think that they're not affected by what's going on with the cuts to both Medicaid as well as other programs and federal programs. We talked about cancer trials. So I think it's my job to talk about how what's happening in Washington, D.C. is affecting every American. And I think I see it as, getting political, the job of the opposition party as well, to talk about that. It's the job of every legislator in Congress, but it's actually the opposition party right now to talk about how this affects every single American. And so, if you're cutting, you see a headline, 10,000 workers at HHS are cut. That's not just for the HHS workers in our district, we do have them. It's also for those cancer trials. Those are for how we administer Medicare. Those are for getting vaccines on time, getting better vaccines, safer vaccines, and curing chronic illness and disease. So this is the things that are happening affect every single American, and I think you're right that we can do better messaging on it. I think the messaging writes itself on this issue. We are taking money from the people who need it most, especially, and we're taking away people's access to care, but we're still spending money on new fighter jets and increased defense spending And when they're not even asking for it and giving tax cuts to the wealthiest corporations who also aren't asking for it. So our priorities are up, is the way I look at it, right? Our number one priority should be the health and safety of every single American, and everything else.
Congressman, may I make a comment because it's relevant to what the woman said and your comment about the cuts to staff. This morning, there was a second page Wall Street Journal article, second page, very top. And for some reason, hospitals, mostly rural hospitals that rely on Medicaid, the Medicaid payment system from HHS went black beginning in mid-February, and they were not receiving they're called tranches of payment or whatever you call them, the bundles of payment. And some of the hospitals are already, as I said, we're spending down our reserves. These are the plans that will occur. So we're getting a little bit of a preview. Again, today, second page, Wall Street Journal will talk about what could happen.
Thank you.
Hi, my name is Greg Masucci, and I'm here as a special needs dad and also as the executive director of a local nonprofit that employs people with IEDs. I'm going to talk to you about something that's a kind of weird analogy, but really essentially taking away Medicare would be, Medicaid would essentially be like a landmine. Recently, people use landmines not to kill people, it's to name the resources of the community or taking up, they're taking more resources out of the community. And the analogy I'm making is this. So before Medicaid, my wife and I both worked. We lived in downtown DC, and we were struggling to pay for all the therapies, all the types of different medicines, everything that are so needed. We didn't have insurance because my wife lost her job, and we were being pushed under and under and under and under to the point where we were borrowing from family and things like that. We finally got a Medicaid waiver. We were able to get on our feet. We are Camden people, and I think most people I look around and I see like Lisa or Eileen or Becky was over there somewhere. So special needs parents are kind of like superhuman in a way, right? But Medicaid, removing Medicaid is like giving kryptonite because after we got on our feet with Medicaid, we were able to both fight the public school system to improve public schools. We pushed through some of those sweeping reforms in DC in the last 30 years. When we came out here, we founded an organization called Farmless Ordinary. We employ 30 people who have IDDs who wouldn't otherwise be working. If you take away Medicaid from me, it's not just taking away Medicaid from me. It's going to take me out of my ability to do these things. The ability to employ 35 people depend on me, right? 35 people, they depend on me for their paycheck and everything else. You take away Medicaid from me, I don't need your one for my son 24/7 because he requires that kind of attention. In fact, he was so self-injurious that we had to consider putting him in another place. Like we didn't think we could keep him safe. And we went to places all over as far as Florida, Pennsylvania. Nobody would take it, which was heartbreaking because it's something we didn't even want to do. And he felt like he couldn't even be safe. And he wanted to go. And you know how difficult it is to tell your kid that even these places won't take it? Right? So that's just what we take away, the ability for us to care for our kids. And I feel like this is so cruel and heartless, and it's going to have this ripple effect, because people like me aren't going to be able to run these nonprofits, and they're not going to be able to, Eileen and Lisa, they're not going to be able to have their jobs. A lot of these people are going to have to quit their jobs, and that's taking taxpayer dollars out of the whole pot and everything else. And for what? So a bunch of people who have too much money to begin with can have more?
Exactly.
And no offense to you, but it's so hard to create people running levels of concern. You have a guy out there with a chainsaw thinking that's funny about cutting these things, and we're writing letters of concern? It's not enough. I mean, I don't know what remedies there are available, but I am pissed off. I'm sorry, excuse my foul language. I am angry, really angry. I've gone down with Lucy before to talk to people in Richmond. I've tried to do what I can. Now my nonprofit takes up a lot of my time, and also because of my nonprofit status, I'm not allowed to be totally political, or we'll lose our nonprofit status. And especially from this administration, but they're nuts. And they're using every tool at their disposal to basically squelch free speech. So I need Congress, at least the people on our side of the aisle, to do more. I don't know what that is, but it's frustrating to watch. It's like watching a disaster unfold in slow motion.
Yeah.
You know, and I don't think people realize all of the downstream events. Like I said, people like me, I won't be able to do what I do anymore. So guess what? Ooh, 35 people are out of work. Because if I'm not doing it, nobody's gonna be able to pay the pieces from what I do. They can't. They're not gonna be able to raise the money. They don't know what to do. You know, and not that I'm irreplaceable, but I'm saying that's gonna happen all over the United States. All over the United States, these people are gonna come out of the workforce. You know, we're gonna have all these open positions, many of whom are nonprofit, strangely, so that'll be even more impacted. So I feel like, yes, we need these 4 Republicans or whatever. Well, how do we get these guys? What can we do? I want some kind of action plan, you know, for what can we do as private citizens to convince 4 Republicans or whatever it is we need to do to save Medicaid, because that's what it's come down to. And these kinds of things, it's easy for people to take them away. It's pretty hard to rebuild them. You know, we lose this, we're gonna be in deep doo. That's all I can say. And all across the board. So please help us figure out a way to stop this from happening. And that's all I would say. And thank you very much. Thank you.
My name is Isis Luciano. I'm the founder and executive director of Thoughtful, which is another nonprofit. I know we have so many in the room right now. For 3 years, Thoughtful has been providing funding for orthotic devices for children who are not properly covered by insurance. So, I'm talking too far away. Yeah. Too small. Wish I could take it out. Anyways, so we live in a nation that criminalizes poverty. As Ms. Takamoto said earlier, about 67% of us are one paycheck away from losing our homes, losing everything, not being able to pay the bills. When you live in a system that criminalizes poverty, you remove a system like Medicaid from that equation, you miss that bill because it had to go to the hospital instead of your home. You lose your home. You get caught for trespassing because you don't belong anywhere and you wind up in jail. That's not good for the GDP. That's not good for anyone. So what we're doing by removing Medicaid is criminalizing disability. And that is something that is not acceptable in any society. All of us, if we have the luxury to live long enough, will live to develop some kind of disability. If you live long enough, you will get a disability and you'll be lucky to do so. It's not, and another thing, you know, our wonderful speech language pathologist over here was talking about the relationship between the Medicaid and school lunches. How many people in this room have starved before? Would you wish that on anyone? And of those of you that have not experienced that, hope you never do. Because looking at yourself in the mirror and seeing your ribs protrude from your body because you are so hungry and you have gone so long without eating, I don't look like somebody with a disability. I know that's not a word, invisible disabilities are valid and important. I don't look like I'm disabled. I don't look like somebody who wouldn't be able to pay my bills. I don't look like the imagined idea of a Medicaid recipient. I was on Medicaid for all of my childhood and the beginning of my adulthood, and I got a kidney infection that almost killed me. And it wasn't emergency services that found out. I went to get treatment because I thought I had a UTI, and that doctor that I was able to access because of Medicaid saved my life. In the same topic that has been acknowledged with the 67% and the birth rate conversation, women who are lower income are more likely to die from obstetric complications when they are pregnant and they are having children, when they're not able to access birth control, when they're not able to see maternity care doctor when a maternal care desert has been created because of overly restricted rules regarding what procedures are allowed. All of those things need to be protected by Medicaid and other systems. It costs over $18,000 to have a baby in this country, assuming you have no income. And that's not for diapers, that's not for bottles, that's not equipment or any of those other accessories. That's not including remotely approaching daycare services, anything else like that. When we're one paycheck away, how are we supposed to spend $18,000? Where is that gonna come from? And so that's we're criminalizing poverty and we're criminalizing the poor who wanna have families. How is that in any way indicative of the values that we wanna hold for our country? I think we can all in this room at least agree that that's not what we want. But as so many people here have said, we don't know what to do. And so we're looking to you, we're looking to other members of Congress, and we are looking to the senators, we're looking to other nonprofits. And we are begging for an answer of something that we can do. We are all willing to fight, but you guys are our hope. And I really, really hope that you can help us get out of this and build a future that we all must.
Thank you. All said. On the birth rate thing, one more thing about that. Sorry, I'm stuck on that. But the plan is to give everyone who has a kid $5,000, but it costs $18,000 to have a kid, and you're cutting Medicaid. It doesn't make any sense, right? It's just going to lower the birth rate even more with their cuts. So it makes no sense. So thank you. And the other thing is, I mentioned before how you're not powerless in this fight. Someone said earlier, stop writing letters. I disagree. Letters actually do help a little bit, but so I keep doing that. It's not that I'm not going to do other things too. We had a sit-in in front of the Capitol steps with Chief Jeffries and Cory Booker. We've done a lot of other stuff. We've been through protests. I've been through town halls and many other things. But your stories really matter. We try to get it in the paper. I tell them on the house, well, with your permission, don't worry. But most importantly, I think making every legislator, Democrat and Republican, understand that there will be a price to pay if you vote to cut Medicaid is the best thing we can do right now as they're debating this budget. Because right now there's some folks who think if they veer away from the president or from someone who opposes Medicaid, that there'll be price to pay for not cutting Medicaid. And they should know that they better save Medicaid, if not only for their future, but the future of all their constituents and every American. That's the way I look at it. Go ahead.
All right, since I only have 1 minute, I am a mother of 2 severely autistic children and a grandmother to a severely autistic child. My children have the Medicaid waiver, and if I didn't have the Medicaid waiver for them, my husband wouldn't be able to work. I wouldn't be able to get all the therapies that they need. They wouldn't be able to go out in the community that they need. Basically, Medicaid has saved our life. I actually went out on disability 10 years ago, and I have Medicare, but thank goodness Loudoun County Public Schools pays the rest of the insurance. But if not, I would have to be on Medicaid myself, just to have insurance to cover medicines, therapies, and to keep my children and myself living in the community.
Thank you.
And I live in Warrenton, Virginia. I'm a certified registered nurse and I spent a lot. Thank you for coming to town hall. What I'm asking today is for you to support HR 2713. It's improving access, care and access to nurses. The ICANN Act, we would eliminate practice barriers for certified registered nurse anesthetists and other advanced practice nurses to provide more equitable care throughout the country. I'll keep a minute. We're out there, we want to care for people. And we want improved access to care for people on Medicaid too.
Thank you so much. Thank you for all of you.
Thank you so much for coming. This is a really important issue in Virginia because we can't get dental bans to people who are homebound without certified nurse anesthetists having independent practice. There's legislation opposing this. And so we want to they haven't been able to get this bill passed, and we want to make sure they get this bill passed. So if you sign up with the Virginia Autism Project, we're going to send out action alerts.
And I have friends and colleagues and myself as well, that want to work on these fans because we want to go to the areas that need us.
Yes, thank you.
Thank you.
Well, maybe it's so spring for the so. And I was on Medicaid for 3 or 4 years, and was just recently removed from it because I got a job that pays me always $19 an hour without benefits. And we need to change. Congress needs to change the regs on how much you can make and how much money you can have in a savings account. Because again, I have no benefits, $0, just 19 an hour, so I don't show up for work because I'm and so I do my food stamps right because they threw me off that too. They put me on, on Blue Cross Blue Shield, it's extra help. I don't know what it is, so I get $3.78 a month for insurance. I used to get $2.81 food stamps, but that $3.79 has been handled first, and after that I get nothing. And so Congress needs to change the regulations from 19 an hour or whatever the cutoff is to maybe 25 to 30 an hour, with or without benefits. Plus your net worth, if you're over 60, your net worth should be allowed to be 100,000, so you can save up for a mobile homes. So you're not constantly living in a hotel with a kitchen. And I suggested this to my congressman at the time 3 years ago. And I believe the first 2 years, Biden had the Senate, the House, he didn't change this. These regs need to be changed, bipartisan, the next time we patrol everything. But my suggestion is going to go over like a lead balloon, but why can't we just 2 or 3 years use the entire foreign aid budget for Medicaid, and food stamps? And take 2 or 3 or 400 billion out of the defense budget, which you guys didn't do when you had everything for 2 years under Biden. So it's coming up to $1 trillion in your budget. And under Biden, may have been 700 or 800 billion, but you could have carved 200 or 300 billion out when you had all houses. So that needs to be done. The defense budget needs to be looked at, and those should not be looked at. And foreign aid budget needs to be eliminated for just 2 years. We have veterans sleeping in the streets, and we're giving 100 billion to this run for Ukraine. And we everybody in this room has needs, and we vote for you. Ukrainians can. And that's it.
Thank you. Really good looking at the defense budget to see how tough some states like state or contract.
Hi, I'm Boardman, I'm a pediatrician, I'm actually, you just moved on to Fairfax, I know.
That's okay, that's okay.
Yeah, yes, we. I gave some information to your staff, but I wanted to just sort of quickly say as a pediatrician, first of all, thanks to all the people who do the real work of taking care of their children, we just get to back you up, we want to back you up, good medical care. The numbers on Medicaid for children are just appalling. It's like 43% of Virginia's children, it's 28% of our youth with special health care needs. It's about 55% of children births. There's some discussion about military, and actually I am going to church him. 220,000 breeding poorly. The children who have TRICARE are also getting covered for Medicaid. That's for the military. Nationally, 3.4 million children and veterans depend on Medicaid for health care. Medicaid covers supplemental health both benefit to your children of active duty members, especially with special military needs. So it's this, you know, if you're gonna talk about the military, we should be supporting the military, not to get that one, get their things. As a pediatrician, I have to talk about how, in fact, if we think about the financing of the medical system and we're all depending on just those with disabilities, if we take this money out of the healthcare system, we're crashing a lot of the healthcare system. And I think that's really an important point for the pediatric practices. It's 40% of our health-based visits, 50% of our hospital admissions, 60% of our infant hospitalizations. I'm hearing rumors that I haven't been able to track it down, but this is going to put a lot of the hospital systems in Virginia underwater. I'm already hearing from my colleagues in Southwest that they're cutting jobs and they're putting the work for it. So this is not just cutting those who are in need, it's cutting everybody's.
Thank you for presentation.
Hi.
Good.
My name is Becky Mallory. This is Kirby. I'm a sponsored residential provider. So Kirby moved in with us January of 2024, and everything about him requires Medicaid. His whole life is on Medicaid, and his parents are in their 80s. He has absolutely no family in the area. And if you take what you do with him, what happens, you know? And he's grown so much in just that year. You know, you can't, it's hard to find that care. And once you find that person who can offer that care, these families, they rely on that, right? Like 100%. My sister is also high functioning special needs. And the thought of putting her anywhere but with myself is terrifying. So when he came with us, it was a personal job, you know, like it's not a job that you just mark off and keep going. He's part of our family now, you know, and like that is it's just so important to him. And as for I grew up 100% off of the system. Medicaid was the only way we survived, you know, food stamps and our health care and everything just revolved around it. And I, luckily enough, made it out of that cycle where I don't need it, but my whole family does. And I don't know what happens if that's not there, you know. So I think that all the way across the board, everybody, no matter what, is affected. You know, and everybody has one family member at least who lives below the poverty limits or the special needs system degree. So when I hear people talking about, oh, it doesn't affect me, it affects everybody. And I just want, like, how can we not, you know, like, these are some of the most delicate and fragile human beings. And the care that I offer, other healthcare providers offer, or group home providers, it's detrimental to their lives. And his therapies, his wheelchairs, ankle supports, everything is covered under his Medicaid. We just got him an AAC device. That's so he could speak one day and hopefully have a voice. That was like $9,000. You know, how do you just expect a family to just come out of pocket with that if they're just barely scraping by? So I think that looking at the numbers of what does it take for an individual to just live even bare minimum, you know, that's pretty large number, you know. So yeah, that's my minute.
Thank you.
Becky and Kirby and everyone, Sherry just reminded me that next Thursday, May 8th, the ARC US, our national chapter based in DC, is helping to hold a rally where they're telling Medicaid stories on the Hill and then having people join for a physical rally The storytelling's at 10 a.m., the rally's at noon, and they're meeting on the mall right across from the Capitol on 3rd Street. Like, these are the stories and voices that they want to hear. So for people asking what else you all can do, I hope we'll see you at a rally.
I'll be there too. So let's all rally. Yes, let's do it. And I would love to just any legislator who wants to cut Medicaid tell the Kirby of the world to their face that you're going to cut their face of their lifeline, right? How could they do that? That's what I don't understand, and that's what I'm trying to understand. But we're better than that as a country. I hope we are. So thank you for your story. I appreciate it.
My name is Sophia Schweitzer. I'm a physical therapist assistant here in Northern Virginia. Work mostly in skilled nursing facilities. I've worked in quite a few around the area. So not representing any of my employers. I have two thoughts to share that have been touched on today. I'm going to express them anyway. One is that money is not the only way to measure value. That's a problem, I think, in our society as Americans that goes back long before the toxic orange ban. Everything has a monetary price associated with, however, it is only one dimension of measuring value. In healthcare, there is not an ROI that returns on that money, and I think that is the guiding principle to keep in mind. The other thing that I see, I've worked with people in a lot of the populations we've mentioned here today. Oops, just a minute. Autism, children with disabilities, end of life care, cancer, homelessness, mental health issues. Some days I feel like the only good thing about Medicare and Medicaid is that it exists. Some days I feel like I'm only able to give them the bare minimum of what they need, and
Yeah, thank you.
Thank you for being here. First of all, I too